When Miss Jenny Lynn Flores Angeles decided to leave the Philippines more than 2 decades ago, she chose Singapore, citing proximity and job opportunities in nursing.
There are wider opportunities for me. I felt like we are treated fairer. Second is multiracial. I adapted easily to the culture. People here made me more comfortable. They are appreciative of you. They are encouraging. I felt no discrimination at all.
Miss Angeles is among 11,000 foreign registered nurses here, making up more than a fifth of Singapore's total nurse population. The Health Ministry says they are an essential part of the healthcare workforce, with support schemes to help them build long-term careers. The system worked for Miss Su Pei Chi, a Taiwanese-turned-Singaporean who's been in the industry for 26 years. She says higher qualifications and expanded roles have transformed the profession, giving nurses greater autonomy, stronger ownership, and a renewed sense of pride.
The nurses are now way more knowledgeable. We know our staff well. Academic upskilling helps. It enables us to communicate more effectively, have more confidence in what we do, and also be able to communicate more effectively with doctors and other healthcare professionals.
Healthcare leaders say sponsorships play a crucial role in strengthening the pipeline, and they start in nursing school.
We regularly bring our clinical partners and MOH holdings into the school to offer sponsorships and scholarships. So by their second and third year, through the extensive exposure during their clinical posting, most students have a sense of their professional nursing identity and the areas that they hope to serve. So we see an increased uptake of sponsorships in the final year of their study. As the sponsorship comes with a bond to serve, we see a consistently high employability rate of about 90% each year.
Beyond career growth, Singapore has introduced financial incentives. In 2024, the Health Ministry rolled out the Angel Retention Scheme. It sees nurses receiving up to 100,000 Singapore dollars over 20 years. Public perception, respect, and support have improved as well.
Nurses before are treated like, change my diaper, take me to the toilet, feed me, bathe me, you're just a nurse. But for now, oh, you are nurses, you are the heroes. Especially when COVID came, we were treated as like Superman with a cape. Yeah, they respect us more and they appreciate us more.
Okay.
But retention remains one of the toughest challenges. Miss Su herself spent some time in Australia, the United Kingdom, and the United States before deciding to stay in Singapore for good.
I will never stop them from going overseas to take a look. Gaining that experience in overseas is essential as part of your growing, and you get to see how healthcare systems in other countries work. But I will always tell them, you probably will end up coming back.
Official data shows record numbers joining the profession in 2024, and attrition rates have returned to pre-pandemic levels. But with global demand for nurses rising, Singapore needs to continue enhancing incentives and opportunities. For now, the country's strategy to attract and retain its nurses appears to be working. Ang Hui Min, CNA, Singapore.